Good night, everyone. Thank you for being in another of my webinars. I want to thank brightbot.com for sponsoring them. I want to remind every one of you that during the webinar, everybody's microphone is going to be muted, but at the end of the presentation, I'm going to give some time for questions, which is my favorite part. I will also like to invite you to record any of your questions that might rise after the presentation that maybe you didn't have time to ask or you didn't think of them at the time. You can go to brightbot.com and record it as a video question, and me or somebody who knows about it will give you some answers. So let's begin. While I put the presentation, I will also like to remind you that this is like my point of view, my experience, and this is some advice for you. But of course, this webinars never replace medical consultation. Today, we're going to be talking about one subject that I really enjoy and I really like. It's Polycystic Ovarian Syndrome. I called this presentation Opening Pandora's Box. So for those of you who don't know me, my name is Jaime Mesa. I'm a medical doctor. I work in the emergency room, but also with chronic disease. And it's like my passion to do it. And I hope you enjoyed the presentation. Polycystic Ovarian Syndrome in the United States. So I like always to start giving some numbers so we can know how important this condition is. 1 out of 10 women in childbearing age have it in the United States. So that's a lot. When I say childbearing age, it's basically from 14 to 44 years of age. That means about 7 million women in the United States have it right now. And it's the cause of infertility for women in more than 85% of cases. So that means it's the most common cause for infertility in women. It is very important. But what am I talking about? What is polycystic ovarian syndrome? Probably some of you have heard about it. Others might not, but I'm pretty sure most women have heard of somebody who has these symptoms or maybe they have it themselves, but they don't know it. Polycystic ovarian syndrome is a condition in where there is a hormonal misbalance resulting in an excess of androgens. Androgens are male hormones. When I say male hormones, I mean that androgens are predominant in males, but that doesn't mean they're not normal in women. Women also have androgens, but the levels are very, very low. Of course, in males, that relation it's different. We also have female hormones, but they're in very low concentrations. In this case, that balance, it's affected, it's disrupted, and now male hormones increase in female bodies. So that's basically what it's about. But it's very funny because this doesn't make sense, or at least it doesn't make a clear connection with the name Polycystic Ovarian Syndrome. Why isn't it called like androgen syndrome or something like that? Well, there's a reason, of course. One of the most common findings are multiple cysts in the ovaries. That's what polycystic means, multiple cysts. And of course, it is so common and so easily explained to patients that we decided to take that finding and put it on the name. But of course, I called my presentation Opening Pandora's Box. So that means definitely there's much more to the syndrome than just cysts in the ovaries. And it's very important, and I really like to to tell people about it because it can change lives. It changes lives. Okay, so why do we open Pandora's box? I don't know if you're related or do you know the story of Pandora, but I'm just gonna give a brief story about it. Pandora was a woman in the ancient Greek mythology. She was sent to Earth as the first woman with a box, and in the box, all evil in the world was inside that box. And of course, Pandora was told never to open the box and release whatever was there. But she did it. She opened it, and all the evil in the world was released. I'm going to stop the story there, and I'm going to continue with today's subject. So as androgens, which are the male hormones, increase in the female's body, this misbalance opens this box and releases a lot of multiple dysfunctions. It triggers multiple dysfunctions around the women's body, such as insulin resistance. I already talked about insulin in the webinar about diabetes, and I already said it was very important, and of course we all know it. Insulin resistance is a condition that is previous to diabetes. It means the body needs more concentrations of that hormone in order to respond in an adequate way. So if the body starts resisting to the effect of insulin, then the body stores this sugar as fat. Then you feel more tired, you feel hungry, then you eat more food that makes your body produce more insulin, and then the circle starts all over again. This is one thing that's triggered by polycystic ovarian syndrome. So it's one symptom. The other one, we call it in medicine hirsutism, which is the appearance of hair, typically in places that are only that males have it. For example, facial hair in the upper lips, in the cheeks, hair in the chest area, and in the back. Usually that's where males have hair, but in females, that's something that starts happening. Also what we call oligomenorrhea, which means that normal menstrual periods start, either you don't have it for a month, for 2 months, or definitely you don't have a period at all. That is also what happens here. Acne is very, very important in this condition. Also related with insulin resistance is obesity. And one of the symptoms, which is the one that usually brings the patients to a doctor's office, which is infertility. So for some reason, women ignore having facial hair, having acne. They ignore having being overweight. But of course, when they're not able to have children, they get worried, and then they go to the doctor, and that's when we start putting all the symptoms together and discovering this. Who will develop polycystic ovarian syndrome? What are the risk factors? Well, of course, it's something that it's in the gene, it's genetic. We're not really sure what causes polycystic ovarian syndrome. We have many theories, but unfortunately, we're not able to trigger one specific cause for that. We do think it has a genetic burden, and for that, we know it's inherited from both parents. So maybe your mother didn't have it, but your father did. And of course, How can a man have polycystic ovarian syndrome if we don't even have ovaries? Well, men have it, of course. Um, the symptoms are different, but for some men, and most, they don't usually develop any symptoms. If we do, maybe would be baldness, for example, because we know baldness is related to an excess of male hormones, especially testosterone. But that's it. But that means he can pass this condition to his children. So definitely, if you have a family member, either mom, dad, grandpas, aunts who had it, you have a good chance to have it also. Diabetic women have a higher risk for developing this condition because they develop insulin resistance, and this is the first step to develop both diabetes and also polycystic ovarian syndrome. We have to understand that androgens, male hormones, they are produced in different parts of the body. Both male and female hormones come from cholesterol. Cholesterol, it's the basic molecule, and then it goes different stages and different transformations, and it becomes both male and female hormones. There are several enzymes that help put something or take something out of the cholesterol molecule to make these hormones. But of course, if you have more cholesterol, more fatty tissue, that means you will have more ingredients to create hormones, both male and female hormones. So of course, people that are obese are at greater risk, or at least that's what our theory says. But what about insulin? What's the role of insulin in this condition? Is it an effect or is it a cause? And that's something that's very difficult to say. We're not really sure if insulin resistance causes polycystic ovarian syndrome, or people with polycystic ovarian syndrome develop insulin resistance. Probably it's both. It's a cycle. So insulin is another hormone, but it affects the ovary and it makes it produce more male hormones. So of course, this is something that's going to trigger the disease. This image that's here in the screen, you see a woman in the floor. That means seizures. We're not really sure. There are two ways females with seizures can develop polycystic ovarian syndrome. One of them, we just know it happens, but we don't know why. Basically, seizures are a risk factor. But we also know that valproic acid or valproate or Valcodi, or how you know, well, that's the common name. It helps develop polycystic ovarian syndrome because it creates insulin resistance. We say to all of our patients that are taking valproic acid that they have to be careful with their blood sugar levels and their weight. So both, not only having seizures by using that medication can trigger polycystic ovarian syndrome. And gaining weight. That doesn't mean necessarily to be obese, which I already said was a risk factor. But we have discovered that before developing symptoms, women gain weight in a short period of time. Maybe they're not obese now, but they used to weigh 130 pounds and now they're 160 in a month and a half. So they had a period in which they gained weight very fast, and that triggered the condition. How do we diagnose the condition? Here's where the name of the condition actually makes sense. So there are different ways of doing it. Actually, the United Kingdom has their own diagnostic like criteria. The United States have another one. They're different, but usually they combine these three things that you see here. Of course, number one could be polycystic ovaries. Might be logic, but actually that's not the first one. The first one means it's hyperandrogenism, which means a lot of male hormones. How we know that? Of course, we have the symptoms in a patient, and we run some blood tests to measure how much testosterone and some other hormones are present in the female's blood. Also, menstrual dysfunction. So, of course, the patient has to have certain problems with their periods. Like I said before, skipping periods or not having a period at all. And the third and the last one, which gives the name to the condition, is having polycystic ovaries. How do we know that? By with a regular ultrasound, we can know it. Basically, you're gonna see very similar to the picture I showed of the ovary with cysts, but you're gonna see like pearls, a little pearl necklace in the ovaries, which are little holes. What are those cysts? Why do women develop it? I'm gonna go back to that picture so you can see that better. Here's the picture. Well, the ovaries are there to produce eggs. That's their function. And they have a cycle every 28 days. Actually, like every 56 days, because one ovulation comes from one ovary, the next comes from the other ovary, and they take turns, right, left, something like that. But in the outer part of the ovary, a follicle, which is like the first part, the first stage of an egg, starts, and it goes and goes around the ovary until it's mature enough to be released. But when you have a lot of male hormones, that follicle never fully develops. So it just grows, and it's never released. So it just creates a hole in there. And then the next one does the same thing until you have a lot of immature follicles that are not useful anymore. So they accumulate there, creating that those cysts there. And of course, if the follicle it's never released, that means you never have a period. And of course, if you don't have a period and if you don't release an egg, then you're not going to be able to get pregnant. That's the reason why infertility is one of the symptoms. And I like to talk about this because fertility, it's very important. I've seen my patients in my personal experience, they are very worried because they think parenthood, being mothers, it's probably the most important part of being a women. And I understand that that's something men are not able to do, and I understand that. So I like to help them. And after I diagnose it, I like to say that hope remains. And that's this is where I go back to Pandora's story. After Pandora opened the box and she released all of this evil, just one thing remained inside the box, and that was hope. And there is hope for women with polycystic ovarian syndrome. Knowing that it is the main cause for infertility in women and that there's hope, that means if women knew more about this, they would solve their problems and realize that there are many things we can do. First, the easiest one, lose weight. If you gain weight very fast and you develop symptoms, losing weight will reverse those symptoms. So many women don't know it, and they're there struggling, suffering, because they're trying to have babies and they are not able to do it. But if we tell those patients, okay, go to the gym or do exercise around your home or in your house, and let's put some like a goal, lose 20 pounds or 30, it depends on each patient, and they have children, they become fertile again with only losing weight. Because of course, if you don't have that much fatty tissue, that much cholesterol, there's nowhere to produce hormones, and the cycle stops, or at least it's controlled. The second, so that's easy. This problem that is affecting a lot of women, 1 out of 10 women, it's easily solved just by losing weight for most of them. And the second thing are taking the pill, birth control pills, because they have, some of them, of course not all of them, but some of them have certain hormones. And when the body starts receiving hormones from pills, the body is perfect. It says, okay, there's no point in me producing more of these hormones because I'm getting it from somewhere else. So they stop producing those hormones and just get used to receiving the hormones from the pill. And of course, we give the dose that you need it, no more, no less. So of course, you will start getting a period back. You will start getting your acne controlled. You will start losing hair from your face, from your chest, and of course, you will regain the ability to have children. Of course, not while taking the pill because it's birth control, but after a while, if you stop using it, your cycles might regulate themselves. And the last, which is the most complicated, but not really at all, are just other drugs to simply block those male hormones. We do have it. Some of it, for example, we use it for other conditions, breast cancer and other types of conditions that are triggered by certain hormones. And some other medications are developed, for example, are made to block insulin action, the action of insulin and insulin resistance. For example, metformin, which is very commonly used for diabetic patients, but it has a very good effect in this condition. It helps control the action of insulin in the ovaries. So this is very, very common. So I've seen patients suffering from this, and when I give them the solution, when I start treating them and they discovered it was so easy, they regain their lives, they regain hope, and that makes me feel great. That's what I love about being a doctor. Give something back to your patients and giving their lives back. And this is very simple. Probably some of you might say, what is polycystic ovarian syndrome? It doesn't sound like something I hear, but probably you will start looking at your friends and say, okay, maybe I have it. Maybe nobody told me that I might be overweight because of this. I do skip certain periods. My periods are not normal. Or nobody told me that this facial hair could be because of that. And I've been struggling with this. So know that there's hope. Go to your doctor and talk to him about it if you have it, and talk to your friends if you think they might have it. Because the downside of this is that it not only affects women in their ability to have children, but of course, I didn't talk about deaths of polycystic ovarian syndrome, because directly it causes 0. But if you are obese, if you have a lot of cholesterol, and if you have diabetes, of course you will develop cardiovascular conditions. So it will indirectly cause you many, many, many problems. It is very easy to solve, and it might help you a lot. So thank you very much. Please, if you have any question, go ahead. You know, I love those questions, and let's start.
Dr. Mesa, does this cause excessive bleeding when you have a period?
Mm, it might. It's not the most common symptom. It might, but usually it actually is the opposite. It causes very little bleeding or no bleeding at all. Uh, Other conditions, for example, fibroids in the uterus might cause excessive bleeding, especially in women older than 30 that they develop this fibroids. That might be the cause.
Okay.
Dr. Mesa, how
Yes.
many of these symptoms do you have to say you do have this condition? Do you have to have more than one, let's say, because a lot of people maybe just are hairless that don't have, body hair, or it could be any other one of the ones that are considered to be symptoms or part of the dysfunction. Oh, how many of them would you need to have to determine whether you should check to see if you have this condition?
Okay, polycystic ovarian syndrome actually has 28 different symptoms, which I didn't mention all of them. I just mentioned the most common, but we have identified 28. But we don't have a specific number that you should have for you to actually have the condition. What we know is that you have to have the three dysfunctions: the menstrual period dysfunction, the cyst in the ovaries, and the third one, which is the highest or higher than normal amounts of male hormones. So what does that mean? Maybe you won't have any symptom, but if we run tests and we discover that you do have a lot of male hormones, maybe if you don't feel anything, but you still have it, maybe we do an ultrasound and we find that your ovaries are too big, or we find cysts in your ovaries, and also maybe you never develop, like you never skipped periods, but yes, you do have a period that only lasts 2 or 3 days. Maybe for you it has never been a symptom, but you might have the condition. So there's not a specific number of symptoms you have to have, but in my experience, most women have more than 3 symptoms. It's just that they're so mild that they're not sure if they have it, or they think it's not related. For example, just a little hair in their upper lip. Maybe they think, oh, that's normal, and that might be normal, because not everyone that has facial hair, not every woman that has it has this condition. But so they think it's normal, and they start skipping periods when they're older, when they're 35. They never did it before. Just these 2 symptoms, it's enough for doctors to study and maybe find out if you have the other parts of the diagnosis.
Okay, thank you.
Okay.
Okay. Dr. Mesa, I'm gonna ask a question.
Yes.
Sound a little bit offbeat, but since this is a female disease, because men do not have ovaries, in the case whereby you said that a child can get it from the father, how would this occur? Could then the father or the male have some sort of disease but would not be called the polycystic disease?
Well, yes, definitely. Males do have polycystic ovarian syndrome. Of course, you're right, noticing that, of course, it wouldn't be called polycystic ovarian syndrome because we don't have ovaries, but we could call it hyperandrogenism, for example. So that means we do have an excess of male hormones. For us, it's not going to be that bad, that much of a problem, because our body is more used to a lot of male hormones. But it will, I said, it might cause certain problems. For example, baldness. People who become bald at a young age, their late 20s, for example, we do know that they have, or most of them have, elevated levels of androgens. So we might have it, but we might not show many symptoms, but we are able to pass that condition to our children. And of course, if we have daughters, they might have it and they will develop conditions. So yeah, it is present in certain men, but it's not a very big problem.
Oh, okay. All right. Just sorry to have me thinking there, seeing that male, do not have the ovaries, but still can.
I understand. And that is something that has changed. We, at the beginning of the when we began studying this condition, we thought the origin were the ovaries. But now we know that that's not the origin. It might be coming from the peripheral fatty tissue, and also in the brain, because the brain produces the signals to create and produce these hormones. So even if you don't have ovaries, I mean, we have brains and we have fatty tissue, so we are able to have other symptoms of this same condition.
Oh, okay. So then when you see like a male that has more breasts than some females, and I know that male can have breast cancer also, would that be a contributing factor?
Not really.
Are they just heavy? They're just fat?
Well, no. I mean, when you are fat, when males are obese, we do. We develop more fatty tissue all around our bodies, certain places more than others. But they're actually a condition in which males develop breasts. And that is different from just being fat, because happens something very similar to polycystic ovarian syndrome, but it's the opposite. Males start producing a lot of female hormones. So it's kind of the opposite. And that can also happen because you're fat. Because like I was telling you, fat, cholesterol, it's the prime matter. Let's say that the first thing you need to have to create both male and female hormones. So if you're fat, if a man is fat, then it might start producing a lot of female hormones. So that makes men develop breasts. But not all fat individuals have it. Not all obese males have this condition. Just some of them. They might seem like they have it just because they're fat, but just there are others. Because it's not only they develop breasts, but they start losing facial hair. Their voices start getting thinner. And actually, it's like the opposite of what happens with the polycystic ovarian syndrome.
Okay, thank you.
You're welcome.
So, Dr. Mace, I don't know if I missed it, but how is it treated?
Okay. The treatment, it's basically, there are three ways of treating it. The first one, which is the easiest, is losing weight. Losing weight solves the problem for most. Of course, if you are obese. If you're not, of course, that's not going to solve anything. The second, it's just taking birth control pills, because it helps you regulate the hormones, the female hormones in the body. And the third one, it's taking medications that act by blocking the male hormones. Those are the three treatments, and they are very effective. It depends on what's your goal, because the different people develop different symptoms. For example, one woman might develop facial hair, no other symptoms, so she just wants to get rid of that. So we might use something to block those hormones. Some other female might not develop facial hair, but she does want to have babies, so we make her lose weight. And some others don't want to have babies, don't have facial hair, but they did develop a very bad acne. So we give them birth control pills for her, so that helps regulate. So it's very easy. The difficult part is to let the women know that they have it, because most women think it's normal. Oh, I don't have a period, that's normal. Or I have facial hair, I guess that's me. Or I'm just a little bit fat, so I'm not gonna do anything about it because it's normal. But maybe you have it and you don't know. That's the difficult part.
Thank you.
You're welcome.
So, doctor, is that something that's normally diagnosed through like a blood test?
Since we have three, like a triad, that you have to have the three things. One of them, the levels of the hormones are diagnosed by blood work. The other are by ultrasound and just symptoms. So that's how we do it.
Right. And one last question I have, I guess you kind of already answered it, but the ovarian cyst situation, that's not, there's no relation between that and what they call fibroids, right?
Not really. Not really. Fibroids are basically created mostly in the muscle. They do have certain relationship with certain hormonal misbalances, but more natural, something that occurs naturally in certain patients, but not necessarily related to polycystic ovarian.
Thanks.
Dr. Mason, you can still present with facial hair and get pregnant? Some people, you could.
Yes, definitely. Hair in certain, well, everywhere responds to certain hormonal concentrations, but the concentrations to stop the menstrual cycle need to be higher than those concentrations required to grow hair. So there's a certain point in which you have a certain level of the hormone that stimulates the growth of hair, but not enough to actually stop the cycle. So yes, because there are certain patients that might say, oh, I don't have any difficulties having children, I have 3, my menstrual cycles are okay, so I guess my facial hair is because of something else. That might not be right. They might still have the syndrome. It's just that it's not bad enough for them to have infertility, but they might still have it.
And like you said, it's hereditary, so the kids can also get it, correct?
Yes, definitely, definitely.
I have a couple questions. First question is that I was surprised to learn that birth control medication is given to stimulate pregnancy, and in the same way that fertility drugs would stimulate pregnancy. So on the one hand, you have fertility drugs, which women take on a regular basis to get pregnant, and now you're saying birth control pills, which prevent pregnancy, are prescribed to help a woman ultimately get pregnant. Is that correct?
It is partially correct, and let me explain a little bit more about it. Infertility has many different causes, and I mentioned that this is the most common one. Of course, we have to take into account that infertility might be because of male problems, which we almost never think of that. I don't know why, but taking those conditions aside, if we talk about female infertility, we divide those into different categories, but these ones are called ovulation problems. So that means they are not able to have children because an egg it's never released. So why is the egg is never released? In this case, with polycystic ovarian syndrome, there's so much, the concentration of male hormones, it's so high that the follicle, which is the immature egg, never develops as a mature egg, so it's never released. So when we give birth control pills that have female hormones, we block the signal from the brain to keep producing hormones, because, like I was telling before, the body thinks that if they're already receiving those hormones from the pill, why take the time, or why do it? Why still producing it? So they just stop producing hormones. So of course, now your menstrual cycle, it's gonna be regulated by these hormones that you're taking in the form of a pill. So you will regulate the whole process again. So those immature follicles with the pills are gonna be able to develop into mature follicles and then ultimately into eggs. Of course, if you keep taking the birth control, those eggs are never gonna produce children. But if after taking them for a while, you stop taking them, some of those eggs might be released and be able to get pregnant. That's how we do it. In this condition, of course. This is not gonna work for any other conditions, basically for this one.
Got another question. You said that a woman who has too much, or not too much, but a woman who has a lot of male hormones will produce, facial hair, and hair in other places that are uncommon for women, and but they could still get pregnant, you're saying. So, how reasonable, or how do you think it happens a lot that a woman will get pregnant or be pregnant maybe several times, and then after having been pregnant so many times, she then learns that she has polycystic ovarian syndrome? Or is that realistic?
It happens a lot. It happens a lot. Because many females, I mean, this is just one explanation, but many females gain weight after they have their children. And if they have more than one, they probably are going to gain more weight. And probably after the third one, they're already 20 or 30 pounds heavier than what they used to be. So that might trigger the beginning of that condition, and that might actually cause the condition to even get worse. And not only now, they're not only developing facial hair, but they're also having menstrual problems or acne or other of the multiple symptoms that you might have. So that might make them go to the doctor, or simply because they went for a regular checkup because they wanted birth control pills. And of course, when somebody goes there, because they have already 3 children and they don't want any more. So we go and we say, okay, what is the best method for this patient? And we see that she's overweight, and then we make some studies and we discover that she has this syndrome. So it's not very unusual. Actually, most of our patients, or many patients, have children and they have polycystic ovarian syndrome, because it's a very common cause of infertility, but that doesn't mean that infertility is necessarily the most common feature of this condition. It is common, but not necessarily the most common feature.
Thank you.
You're welcome. Well, Okay, thank you everybody again for being here and for paying attention. And I hope you enjoyed it as much as I did. I enjoyed your questions very much. Remember, if you have any other, you can go into brightbot.com and just record your video question and we'll answer it. So we'll meet again next Tuesday for another webinar. Have a great night.